Hello and welcome to webinar series. Myself Shanti, and today's topic for discussion is all about on blood transfusion safety among the elderly patients. Yes, for this I now request all the speakers in the panels to introduce, but I like to introduce about our expertise, who is Dr. Nandakishore Garu, who is our senior consultant and head of the department for transfusion medicine from Yashoda Hospital, Somajiguda. I welcome you, Dr. Nandakishore.
Thank you. That's a great warm welcome, Shanti. Thank you very much.
Thank you. And yes, over to you, Dr. Priya and Rama, for your introduction. Yes, Dr. Priya, we like to hear from you as well.
Good afternoon, Madam Shanti Bhattacharya, the organizing mentor, and Dr. Nanda Kishore, the expertise, and Ms. Rama Devi. Good afternoon. Good afternoon, my dear students. And myself, Priya Darshini, the principal of Adarsha College of Nursing from Bangalore.
Yes, Rama.
Good afternoon, everyone. Myself, Rama Devi, nursing officer from Government General Hospital, Manchurial.
Yes. So I'm privileged and honored to be associated with you all. Let us see what we have in our today's time-bound session. Yes, as the blood transfusion procedure or the intervention is a very risky, bedside intervention. So we like to understand firstly from Dr. Nandakishore, if we are talking about this blood transfusion, like what does blood transfusion safety mean for elderly patients? In a very simple term, what we like to tell to our viewers who are all our nurses. Yes, over to you, Dr. Nandakishore.
Yeah. Thanks for bringing up this topic, Shanti. This is a very important bedside clinical activity in almost many patients, whether it is medical or surgical patient. There is a lot of importance carrying with the blood transfusion because it can help and also can cause some risk if the protocols are not followed properly. So it's very important to have a awareness on the blood transfusion safety, and especially with the extreme of ages like pediatrics and elderly. And thanks to you, you brought this into the limelight to have the safe transfusion in elderly patients, because there are a lot of other factors which we'll discuss in the course of the session, how they behave during the transfusion, unlike with the routine adult patients.
Yes. So thank you for this brief, insight, and they also carry few potential risk. Would you like to just give your insight on the same? Like what could be little few potential risk for the elderly? Like as we were discussing, they may experience allergic or febrile or hemolytic reactions. How one should select and what nurses should know? Yes, over to you.
Yeah. So when it comes to the elderly patient, their circulatory system is very plastic. Like, it may not accommodate a lot of fluids, so they are very much prone for overloads, particularly with elderly, like around 70 to 80 years.
Yes.
And the chances of febrile reactions and allergic reactions can be and many of the elderly patients, they are having comorbidities like diabetes or hypertension, where there is already hypertension is there, and sometimes these reaction can cause add-on blood pressure for them, and it can cause a cardiac overload. So it is always better. We should be very much aware of what we are doing with the elderly patient.
Yes. Yes.
Yeah.
The careful monitoring also is required. Now we like to understand from Dr. Priya, like does careful monitoring by nursing staff, or we get to see a lot of student nurses coming to the clinicals for their clinical exposure. I mean, is this important for them as well? Yes, for your side, Dr. Priya.
Yes, it is very important to identify the early signs and symptoms such as a fever, chill, or a shortness of breath, respiratory distress. During this time, nurses need to stay with the patient during this time, watch for any unusual signs. Timely intervention is very important. If any reactions happen, the nurse must stop the transfusion immediately, inform the doctors, start emergency medicines like oxygen or any prescribed by the medication by the physician. Or the patient safety has a with the blood transfusion to be taken care. Nurse helps the patient to understand and process the encourage them to report any discomfort or any symptoms immediately. This build the trust to ensure the quick actions among the something goes wrong during the postings.
Yes. So as
Yes.
you very rightly said, I mean, nurses, student nurses also, must learn all this primary criteria whenever they see their patient is experiencing the discomfort. Yes. So yeah,
Just to add a
Rama, are you
point,
there? Or yes,
yeah, just to add a point to Dr. Priya's discussion. So the timely interventions during the transfusion, the early phases, the most common reactions are allergic and fever,
yes,
during the course of transfusion, TRALI and TACO are the things which we should be aware of and we should be taking care of.
yes. So Dr. Nandakishwar, I wanted to even understand TACO and TRALI is common among this elderly group, or it based on the pre-existing conditions and presence of comorbidity?
Yeah, as you said, TRALI has a thing like pre-existing things of lung issues,
Yes,
lung diseases in the patient,
yes,
and when the blood component has some leukocyte, anti-leukocyte antibodies,
yes,
especially which develops in, from the donors where they themselves had multiple sensitizations, like
yes,
pregnancies in case of female donors or donors who had previous transfusions and recovered and then they started becoming a donor. So such people, they develop anti-leukocyte antibodies which can cause TRALI.
yes,
So that is one thing. And second thing is regarding TACO, these patients usually they get transfusions and they might be having comorbids and they will be admitted in ICUs where already there are going fluids and all.
yes,
So patients with renal issues, they will be on fluid overload. So for such
yes,
patients, you should always take care of the rate of transfusion, which is 1 to 2 ml per minute for a safe transfusion. So
yes, yes,
in cases of overload, you better give a diuretic and then start the transfusion. So monitoring the fluids, positive balance and fluid balance is very important in these cases.
yes, yes. Yes, as rightly you said, first initially 15 minutes are very crucial, and we request all the nurses, bedside nurses, to monitor the rate factor as well. And yes, sometimes we see fresher nurses or nurses struggling in choosing the blood set. So this picture, which I have tried to portray here, is standard blood transfusion set. And Dr. Nandakishwar, you will also agree that this is the set which we use for the blood transfusion. And yes,
Yes, this
yes,
transfusion set definitely helps a lot. Like having a micro aggregates and all these, they get
yes.
filtered at this chamber where there's a filter in between the set.
Filter,
And
yes,
observing the first 15 minutes of transfusion will help you to get rid of or fever and allergic reactions. And
yes,
provided the patient is stable, you can increase the rate, but not beyond the recommended flow rates.
yes,
Especially if the nursing student or staff, if they are uh, having extra other works or has to go home or something, you should not rush the blood transfusion.
yes. You should not rush with the rate. Yes, yeah. As
It
rightly
should
said,
take
yes,
its time. Yeah,
yes. And we should be very, diligent in giving the handover, even with the,
exactly.
the blood bag. Yes. So, what are the few key aspects of careful monitoring? It should be done by bedside nurses. Like I tried mentioning vital sign, all this. So, yes, Dr. Priya, I mean, you think these points are important for all the nurses to just monitor?
Yes, bedside is essential for the patient safety and early monitoring, like recording the vital signs, observation of the signs and adverse symptoms such as rashes, itching or a shortness of breath, chill, rigor, and the temperature. As a nurse, first notify the clinicians, administer, and the documentation is important.
Yes. So yes, Dr. Nandakishore, you must be
So
getting a lot of incidents because you do RC and lot of corrective and prevention, step you take, and you train and educate even not only the nurses, working professional, even to the college students as well. So yes, so any other, missed point which you like to,
yeah.
highlight here?
So careful monitoring starts with the matching of the blood unit with the patient. So the
Yes.
identification of the blood unit, whether this is meant for the patient or not, that is to be done by two qualified nurses, and then start with keeping everything ready. So you should
Yes.
not run for for the IV cannula, all those things.
Yes.
So everything you should keep ready. You can avoid the meal timings of the patients, because sometimes there might be some nausea during the blood transfusion. So better they can complete the meal and then transfuse, or they can, if they are willing to go to washroom or anything, then after that you can start the transfusion. And once you start the transfusion, you should observe, as Dr. Priya has said,
Yes.
vitals and anything which is not there before the transfusion, like rashes or change in the
Yes.
vitals, like hypertension or hypotension, any
Yes.
chills or breathlessness or giddiness, anything can be there. Hypotension is also very important thing
Yes.
which should be observed.
Yes. Yes, as rightly said, the right assessment is a key to see this errors. Yes. So yes, what should be done if the patient is experiencing, as we were talking, allergic and febrile reactions and maybe the hemolytic reaction. This word may be little new or maybe requiring for us to give the awareness in this session today. So what should be done if at all patient experiences these kind of scenario? Yes, Dr. Nanda, for you.
Yeah, so if the patient is experiencing not only hemolytic reaction but any type
Yes,
of reaction, you should stop the transfusion at the first instance, and inform your consultant obviously, and also the blood bank. So this
yes,
will help you not to cause more harm to the patient. So if
yes,
once you inform to the blood bank, they have to check for the ABO compatibility, all those things, and make sure that there is no ABO incompatible transfusion.
yes,
And also you have to check the blood bag whether it has any hemolysis. So bedside it is not possible, so you have to send this blood bag along with the BT set and post transfusion blood samples and urine sample for this investigation at the blood center. So we,
yes,
with those things, blood center will do the Coombs test and urine test, and indirect Coombs test, and
yes,
repeat cross match, repeat blood grouping of the patient, and they will identify whether there is any ABO mismatch or which is causing the hemolytic reaction. And they'll also check the blood bag whether there is any hemolysis in the blood bag. So hemolysis of blood bag can happen if the blood bag is not stored properly, or
stored properly.
transported in a warm container or
Yes,
in the sun, or it took a long time, particularly in
yes,
tier 2 towns and all. They are bringing the blood from a faraway blood bank. Maintaining the temperature during the transport
also,
also
yeah,
is very
yes,
important. So all those things they will investigate and give you a report which is called as transfusion reaction report, and this has to be filed into the case sheet also.
yes,
And
yes,
such reactions has to be updated with the Hemovigilance Program of India, and every
yes,
hospital has to get enrolled into this program. And whenever there is any reaction, whether it is a hemolytic reaction or a simple allergic reaction, they should inform through the HVPI portal.
yes. So
And
yeah,
if there is yeah, if there is minor reactions like allergic reaction, you can probably give Avil and Hydrocort, and try to continue the transfusion. But many a times, if the culprit blood bag is creating a reaction, even with the pre-medications or the medication, it can again lead to the
cause a
reaction. So
reaction.
yeah, cause
Yes,
the reaction. So mostly it is better not to transfuse that unit, and get a new unit for that patient for transfusion.
For the
If there
patient,
is no
yes.
time, or yeah, if
Yes.
there is a rarity in the blood unit, then probably yeah, you can give avila hydrocard for allergic reaction and then continue the transfusion. But if it
Yes.
is causing a TRALI, then better it should not be given. If it is a hemolytic reaction, then better you should not transfuse that blood unit.
Yes. And as you said, reevaluate as per the clinical decision team.
Yes,
Yes.
yes.
Yeah.
So the patient has to be re-evaluated for testing for CBP,
As
like
you said. Yeah.
understand the hemoglobin level, whether hemoglobin is within the transfusion trigger. Then probably yeah, you can defer the transfusion also if the hemoglobin is good enough.
Yes. So what happens at your facility, Rama? We have Rama who joined again. Yeah, all this like reactions in terms of allergic or febrile, should do you raise the incidence for the same, Rama?
Yes, ma'am. We will inform to the duty doctor and as well as to the blood bank staff regarding the
Yes.
reactions. So, yes,
Yes.
ma'am. They will notice and after that recheck the blood bag again and they ask us to send the sample of the patient again in order to recheck the blood group of the patient and blood bag.
Yes, very, very rightly you said. Yes. Now, this is again this important slide which we wanted to understand from Dr. Nandakishore, like nowadays, or maybe the guidelines have changed, or I don't know, it is your opinion for the same, like should pre-medication be considered? Like, yes, I wanted to understand from myself also, for myself as well. Yes. Over to you, Dr. Nandakishore. Yes.
Yeah, yeah. So every transfusion is very vital.
Yes.
We are trying to help the patient recover from their medical or surgical illness by giving this blood transfusion.
Yes.
But the transfusions in the previous scenarios, if they have caused any allergic reaction, fever reactions, or any type of reactions, if they are aware of, then pre-medication can be considered. Otherwise,
Yes.
routine pre-medication is actually not much useful. Sometimes it may
Yes.
not prevent also. But for
Yes.
those patients who are experiencing allergic reactions, yeah, pre-medication with avil hydrocard can be useful. If the patients are prone for fluid overloads, then
Yes.
proper fluid monitoring before transfusion is important, and during the transfusion also you have to follow the protocol of that 1 to 2 ml
Yes.
transfusion. But
And
otherwise, as a standard of practice, pre-medications are not recommended for each and
yes.
every transfusion.
Yes.
Patients
So,
on regular transfusion requirements with having allergies with every transfusion, yeah, for them, pre-medication can be done.
yeah, and most of the time we see this previous transfusion reactions or receiving transfusions are not documented, and nurse may skip this point. So, right from the initial assessment, she should also ask the patient whether they have any blood or blood transfusion or blood product history, so that we
So
can use
collecting that
enhanced.
history of transfusions is very
Yes,
important,
very
and
important.
particularly in our hospital, we have the column to mention the previous transfusion history and also whether the transfusion reaction history was there or not. So
Also,
we get that
yes,
history from the patient ward side regularly.
yes. Yes, that is, yeah, rightly, as you mentioned, yes. And how long can a blood bag be kept unused in the what scenario? As we are discussing, like a patient must have experienced allergic reactions, and then she takes a little time to intervene, notifying the doctor, blood bank, and all that. All this will take a lot of time, or little time limits has to be there, because nurse is intervening for the patient safety, or re-evaluating the transfusion need again. So what is your point on the same? Like, Rama, we want to understand from you, like, yes, what do you do at your setup?
So within 15 minutes of blood transfusion, if the patient got any reaction, so we have to stop the transfusion immediately and we have to disconnect the thing and we have to send it to the blood bank.
Yes. So yes, as rightly said, yes. So what should be the time period, Dr. Nanda? Like, we just wanted to understand, because here time limit also should be given to the nurses, and As you know, in the hospital ward and ICU fridges are like, they may not know the temperature of storing leftover pack. And because efficacy is important for us. So yes, for your shorter insight. Yeah, over to you.
Yeah, so it depends on whether the patient is ready for the transfusion or not. Okay, for elective cases, usually you should not ideally keep any blood units in the ward.
Yes.
So get it
Yes.
from the blood bank and do the checks, identification checks, expiry date, all those things, and start this transfusion as early as possible, because transfusion itself will take 4 hours of time. And once opened, the blood bag also is a uh, very good nutrient medium for the bacteria to proliferate.
Bacteria.
So
Yes.
yeah, so beyond 4 hours of transfusion, the blood bags gets infected. So even
Infected.
if
Yeah.
there is any reaction, you better not to keep those blood units at the ward. It has to be properly sealed and sent back to the blood bank,
Yes.
because during the workup of the transfusion reaction, we also send a some amount of blood from the blood bag for culture. So if it is kept in the ward and it accidentally gets infected, it might be representing that the blood bag is infected. So better not to keep any blood units unused in the ward beyond
Yes.
15 to 30 minutes, that's all.
Yes. So, yes, as rightly said, because many of the nurses may not aware, maybe they take their own time because they are also assigned the other patients as well. Yes, going forward, if restarting the transfusion not indicated, as I think we have discussed the same, monitor, notify blood bank team and send remaining blood back, as you said. But communication with the family member also is very important. Yes. So now going forward, few precautions to be kept in mind before transfusion. We like to hear from Dr. Priya. What could be these precautions which everybody should keep in the mind? Yes, few precautions.
Yes, before starting the blood transfusion, always verify the patient identification. Always check the patient full name, ID number, and the date of birth. The double check of the blood component matches whether the blood bags are expiry date or integrity or any damage or a leakage, the color of the clarity, any
Yes,
discoloration of the clots. Do not use those blood looks abnormal. That is one thing. Then inspect the blood bag damage, any leakage or any hemolysis, monitoring the infusion. Those are the things we have to keep in mind before transfusion the blood.
yes, and we like to tell everybody that this infusions, blood and blood products are also high risk in nature because it is all triggering the immunology of the patients. So yes, a few precautions and it should be kept in mind. Yes, going forward, few myth or the mindset which happens among healthcare professionals we need to clear here. Can a patient eat while receiving blood transfusion, Dr. Nanda?
Yeah, I would say better they complete their meal before the
Meal.
transfusion.
Yes.
Yeah, because there should not be any disturbance during the transfusion, which will delay the time of the transfusion. So it is better they complete the meal. Suppose if the
Yes.
transfusion has already started and the meal time is there, and yeah, they can have it provided if there is no complication. If there is any vomiting or anything, we should rule out
Yes.
both from the food and also from the blood transfusion.
Yes. Yes.
So yeah, otherwise, if there is no complication, yeah, they can have a meal during the transfusion.
Yes.
Yeah,
And
and yeah,
yeah,
but
we like to
the
hear from Rama
infusions, other
here. What if
infusions,
other infusion or IV has to be continued? What is your protocol or what you nurses practice? Because many a times, if at all the 2 o'clock infusion is still on and you are going to start the antibiotic for that 2 p.m. dose, what you do? Yes, Rama, for you.
We can start other IV line for medications. No? We should not disturb the blood transfusion.
Yes, I think yes, Dr. Nanda, you will also agree with the same. And also, we like to
yeah.
understand if the
So
patency or flow rate
most
is
of the
little disturbed, can
so
we
most
flush
of the
the
times,
lines? Yes,
most of the times antibiotics will be given with a test dose. So if the test dose is fine and they are going good, yeah, it can be given. But if it is a new antibiotic which has to be given, time it before the transfusion or after the transfusion, because we may not be understanding if any reaction happens, whether it is because of
Yes.
the new drug or because of the blood transfusion. That's point number one. And point number two is always keep a separate line for the blood transfusion away from the
Yes.
line where the other infusions are going on. We cannot
Yes.
mix the blood transfusions and the drugs together in the same line.
Same line. Yes.
For two reasons. One is some drugs can cause hemolysis of the stored blood component.
Yes.
The is the type of reactions, if happens, we will not be able to understand for which
Yes.
it has come.
Yes. And one more very vital point is hand hygiene, maintaining all
Yes.
this universal precautions, closing the port and cleaning the port and then reconnecting the catheter. This is very important. Yes.
Very
Yeah,
important.
we are
Yes.
coming to the end of the discussion. I know this is a very big subject and 15 minutes or 20 minutes a given time is not enough. But yes, we promise that we'll keep our session time out. Yes. And the last insight from Dr. Priya we like to hear, how should blood transfusion safety be done? Especially because you mentor a lot of students under you, being as a principal for, big institute. Yes, over to you, Dr. Priya.
Yeah, periodic training provides a regular interval to maintain and update the skill or the knowledge in a classroom and in the hospital settings. The
Yes.
student nurse are posted in the blood bank mainly to gain the curricular experience in a transfusion, medicine, and the hematological learning, practical skill, and theoretical knowledge. So it is very important to update the student nurses regarding this.
Yes. Yes, I see Dr. Nandakishore, I always see Dr. Nandakishore teaching and telling the students about the same. And most of our nurses, even we have nurses, working professionals at blood bank to screen the donors and patients. Yes. And yes, I like to thank everybody here, Dr. Nandakishore, Dr. Priya, and Rama. Yes, everybody for your valuable, presence here. Yes. At end, we are ending the session. Anybody has any insight to be presented on, and then we end. Yes.
I would say one phrase where uh, if your brain doesn't know, you cannot understand what is going on with the patient. So
Yes.
if brain doesn't know, your eyes cannot see. So periodic awareness, I mean periodic training and awareness sessions, learning sessions at induction and regular training is very mandatory for having a safe blood transfusions at the
Yes.
wards.
Yes. So that's what we tell all the student nurses. Whenever you get your clinical exposure right from your first year to fourth year, please observe not only theory, knowledge, even skills are very important. Do ask. There are doctors around. Do ask, take the notes, refer, and practice. That is how, yeah. So we end the session. Thank you, everybody, for your time. And thanks from Yashoda. And maybe coming second again is falling on Thursday, which is going to be observed as the Vijayadashami. We wish all our viewers a happy Vijayadashami and happy Gandhi Jayanti. So little relaxation time for me that day. I will not be able to come for the webinar. Yes, and forthcoming week, the next week of October, we will again connect. Thank you, Dr. Nanda and the rest of the team. Yeah,
Thank you, ma'am. Thank you.
Thank you, Shanti, for making this
thank you.
webinar. Thank you, Dr.
Thank
Priya
you.
and Ms. Rama Priya. Yeah.
Yeah,
Thank
thank
you.
you.